is Cynthia Duran, and I will be recognizing the dimensions of a correctional social worker. So first is having knowledge about the principles, procedures, techniques, trends, and literature of social work. They also need to know of social aspects of the mental and developmental and physical disabilities. Second is the values, which is that correctional social workers should have empathy, great communication, they should have patience and have critical thinking, be fair amongst groups, and have a good organization skills. Next is ethics, which is to have respect for prisoners, and having professional and compassionate service is also important. The behavior that they should have is to be professional, of course. They should treat people with respect and be honest. They should have great communication skills and always be supportive. Appearance is also another important dimension. They should be aware of how they first present themselves because first impressions do matter. The way you present yourself can show the effort of how much you really care about your job. Wearing professional clothing with a smile on your face should do. Having successful communication is a very important skill to be able to help others. It is also important to be an active listener to show that you care. The roles of a correctional social worker is also to evaluate the inmate's mental health. They are to provide counseling and support to individuals and groups. It is important to preserve records regarding the prisoner's care. Communicating with others in the correctional workforce about the inmate's care progress is important to have in order to have successful person-centered care. So lastly, it is always important to set boundaries with inmates when working in a prison. It can be dangerous, so it's crucial to stay safe and be professional. And so at last, they should treat all inmates with dignity and respect. Thank you.
Hi guys, my name is Jalissa, and today I'm going to be talking to you guys a little bit about what it takes to be a CPS worker. So you need a bachelor's of social work degree, 3,000 hours of supervised experience over the course of 2 years in clinical psychosocial diagnosis, assessments, and treatments. You also need fingerprint requirements, criminal background checks, and to take and pass the California Law of Ethics exam. So some of our values as a CPS worker is we have to show the importance of human relationship. We have integrity, competence. We make sure there is no social injustice, and we give our service to the people that need help. And we help any child that is in any abusive or neglectful household. So the behavior that a CPS worker has to have is you have to be open to listening to any and everything a child has to say. Become a very trustworthy person to this child since they are trusting you with this information that they have. Make the child feel as comfortable as they can be. You have to be confident and authoritative in any decisions you do have to make. Can't, or at least try not to get too attached to the children that you are working with. And all in all, we have to make these children feel safe and heard. As for the appearance of a CPS worker, I want to say that it's just business casual, so just have to look presentable, especially towards the families that you're going to be working with and to the children as well. For communication, if somebody is ever worried or concerned about any child that is being neglected or abused, you can call the CPS emergency hotline, and a social worker will be on the case immediately. Social workers communicate with the police if the measure is really extreme. Also, social workers may give out their card to the children just in case the child ever feels endangered or just needs any help or anyone to talk to. We are here for that. Some of the roles a CPS worker does is we go and review alleged cases, and we go through and learn about them. We investigate and interview the family and children, just trying to get more information out of them to see if the case was true or if everything was okay. We collect evidence corresponding to what is happening, like records, court hearings, anything like that. We plan out how to approach the situation, help and solve it. Lastly, filling out any paperwork as needed to get it sent in and report to what has been done to help this child in need. Some of the boundaries that CPS workers have to go by is we can't enter any home without any permission, can't force you to take a drug test, and we have to investigate any and every claim that has been made. But we can talk to the child in question without a parent permission, can show up unannounced and ask the child questions, and can terminate any rights to a parent.
Hi, I'm Lily Ritter, and I'm representing the mental health dimension of social work from the perspective of a therapist. including knowledge, values, ethics, behavior, appearance, communication, roles, and boundaries. The mental health dimension of social work involves necessary knowledge of clinical psychology as well as the essential degrees, training, and certifications. In regards to the value of service in social work, therapists practice it by engaging in the ethical practice of helping their clients in addressing their problems. Therapists apply the social work value of dignity and worth of a person by following the ethical practice of respecting their clients' inherent dignity and worth. Counselors engage in the value of the importance of human relationships in social work by executing the ethical principle of recognizing how central the quality and health of human relationships are to their clients. They follow the value of integrity by implementing the ethical principle of behaving in a trustworthy manner. Therapists execute the value of competence by performing the ethical principle of practicing within their areas of competence, as well as developing and enhancing their professional expertise. Therapists are expected to behave professionally with clients and respect the therapist-client relationship. Breaking any barriers in that relationship by acting unprofessionally can negatively affect the relationship between therapist and client and be detrimental to the client's experience with that particular therapist, as well as their overall view of therapy. In regards to appearance, most organizations have their own dress code that therapists have to follow, but all therapists are expected to dress professionally and maintain certain hygienic standards in the workplace. Therapists communicate with clients mostly by appointments during office hours, although some therapists may give clients their personal contact information for therapy emergencies. Counselors serve many roles for their clients, including offering therapeutic advice in what's commonly known as talk therapy, as well as sometimes referring clients to psychiatrists if they think medication would be beneficial. The most well-known boundary of the mental health dimension of social work is HIPAA, or the Health Insurance Portability and Accountability Act of 1996, which requires the therapist as a medical professional to protect their clients' confidential health information from being disclosed without the client's knowledge or consent.
Hello, my name is Abigail Camacho and I'm representing the education dimension of social work. I will be demonstrating the perspective of a school social worker. So we'll first go over the knowledge that is needed to become a school social worker. The first thing you will need as a school social worker is to be certified through the Department of Education. School social workers should also be specialized in understanding current perspectives of public school education at a local, state, and national level. They will also need to be knowledgeable in evidence-informed approaches to teaching and learning positive academic outcomes for all students. School social workers serve as a counselor, advocate, and case manager. As a school social worker, they need to have values. So some of those values are going to include service, social justice, dignity, worth of a person, importance of human relationships, as well as integrity and competence. A school social worker should always obey the professional ethical responsibilities delineated in a NASW Code of Ethics. School social workers learn about ethical decision making to keep up with the professional values. They would also need to learn about the ethical decisions in order to help people in need. We will now talk about the behaviors that is needed as a social worker. Those behaviors are required to work in a school. And some of them are going to be essential skills such as empathy, communication, critical thinking, active listening, patience, and so forth. Those behaviors are the most important since you will be dealing with a lot of students throughout the day. Now we're going to talk about the appearance of a school social worker. It is best for the social worker to come professional. So in a blouse, slacks, nice shoes, hair done properly, and if they're usually working outside of an office, a casual attire is probably best. Most social workers have stated that the key to becoming professional or staying professional is the way they come off when they dress. Now we will be talking about communication and how important it is. Since communication is a big role, is used in it a lot while working as a social worker. It is important just because you are speaking with clients throughout the day. You're combining critical information and making important decisions. So that's one of the big roles in becoming a school social worker. Lastly, we'll talk about boundaries and how important it is to stay professional while working in a school. So some boundaries that a school social worker needs to set before taking any clients is being professional, truthful, honest, and respectful. When a school social worker is dealing with a client or a student that day, they need to inform that client or student to be to agree to the terms of those boundaries before any session. So that is about the education dimension of a social worker. So thank you.
Hi, my name's Leslie Cruz, and today I'm going to be talking about what it takes to be a medical social worker, such as their knowledge, their values and ethics, their behavior, appearance, communication, roles, and their boundaries. So today we're going to start off with talking about knowledge. In order to be a medical social worker, you have to obtain your bachelor's degree and your master's degree. Your bachelor's degree can be in social work, sociology, or any similar discipline. However, your master's degree has to be in social work. After gaining both those degrees, you had to apply to be an ASW in order to be able to gain that supervised experience. Without registering as an ASW, you will not be able to get that experience. Once you've done that, you must pass the California Law and Ethics exam and then get your supervised experience in order to get your medical license. After you've completed those steps, you take the ASWB, the clinical exam, and you can then apply to get your license. So your values and ethics. All medical social workers have to adhere to the NASW Code of Ethics. Your behavior. Medical social workers should conduct themselves with integrity, with empathy, communication, and many other qualities when speaking or dealing with any patient. They must also be sincere and truthful with their clientele because this is a very intimate field that we're going into. So for your appearance, when working in a hospital, regardless of your position, you have the option of wearing scrubs or business casual if you are part of the interdisciplinary team. Because of the COVID-19 pandemic, wearing scrubs as a medical social worker is a more recent option in hospital settings. For your communication, medical social workers collaborate in multidisciplinary teams and communicate with a wide range of experts that include doctors, nurses, physical therapists, discharge coordinators, and administrative personnel. They also communicate with patients and their families to explore therapy and any treatment alternatives. So for their roles, medical social workers have to assess patients' physical and psychological needs. They answer questions for patients and their families, such as why their treatment plans changed or when they're able to go home. They
They also provide financial planning assistance for anyone that needs it. They develop discharge plans, individual and group counseling, and advocate for patients' rights when patients themselves feel like they can't. So, for boundaries, medical social workers should only have professional relationships and no other relationships outside of the services supplied. Your clients are not given any unnecessary or personal information because it can put you and your clients at risk. So, being a medical social worker is such a demanding profession. Therefore, maintaining a healthy work-life balance is critical. Respect your client's personal space and use of contact while being honest about your own. So this means like you have that boundary set where like you don't like hugging or being in someone else's personal space. Let that be known with your clientele because that is such an important thing to know when dealing with patients. So that was my presentation on being a medical social worker.